Diabetes. It's a word we hear almost every day. But what is it really at its core? And why is it affecting so many people around the world today? Today we're diving deep into the world of diabetes. Its prevalence, causes, signs, how it's diagnosed, treated, and most importantly, how you can prevent it. Globally, over 500 million people are living with diabetes, making it one of the most widespread chronic diseases of our time. This condition affects people of all ages, backgrounds, and walks of life, touching families and communities everywhere. The impact of diabetes goes far beyond individual health, influencing economies and healthcare systems worldwide. According to the World Health Organization, that number is expected to rise significantly in the coming years, with projections suggesting that hundreds of millions more could be diagnosed if urgent action is not taken. The rapid increase is driven by factors like urbanization, changing diets, and reduced physical activity. In many countries, especially in low and middle income areas, diabetes has become a public health crisis, affecting both adults and an increasing number of children. Limited access to healthcare, education, and healthy food options makes prevention and management even more challenging for these communities. Diabetes is a complex condition that affects millions of people worldwide, and understanding what causes it is crucial for prevention and management. There are several different types of diabetes, each with its own unique causes and risk factors. The most common forms are type 1 and type 2 diabetes, but there are also other less common types. Type 1 diabetes is often diagnosed in children and young adults, while type 2 is more frequently seen in adults, though it is becoming increasingly common in younger people as well. Type 1 diabetes is usually caused by an autoimmune reaction. In this process, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without insulin, the body cannot properly regulate blood sugar levels, leading to the symptoms and complications of diabetes. This type of diabetes often starts in childhood or adolescence, but it can develop at any age. Genetics and certain environmental factors, such as viral infections, may play a role in triggering this autoimmune response. Type 2 diabetes, on the other hand, is largely driven by lifestyle factors. Poor diet, physical inactivity, and obesity are major contributors. But genetics also play a significant role. In type 2 diabetes, the body either becomes resistant to insulin or doesn't produce enough, causing blood sugar levels to rise over time. Making healthy lifestyle choices can greatly reduce the risk of developing this type. Other forms of diabetes include gestational diabetes, which occurs during pregnancy. This type develops when hormonal changes make it harder for the body to use insulin effectively, and it usually goes away after the baby is born, though it can increase the risk of developing type 2 diabetes later in life. There is also secondary diabetes, which can be triggered by certain medications, such as steroids, or by other diseases that affect the pancreas. Understanding the different causes of diabetes is the first step toward effective prevention, early detection, and better management of this lifelong condition. Some common signs and symptoms include, things like frequent urination, excessive thirst, unexplained weight loss, constant fatigue, blurred vision, slow healing wounds, and numbness or tingling in the hands and feet. Sometimes, symptoms can be pretty mild, or even go completely unnoticed. That's why early detection is really key. Diabetes is usually diagnosed through blood tests, such as fasting blood glucose, HbA1c, which measures average blood sugar over about 3 months, and the oral glucose tolerance test. If your levels are consistently high, your doctor will confirm a diagnosis of diabetes or prediabetes. For people living with type 1 diabetes, daily insulin therapy is absolutely essential. This is because their bodies are unable to produce insulin at all, making it impossible to regulate blood sugar levels without this vital hormone. Insulin can be delivered through injections or an insulin pump, and the dosage is carefully tailored to each individual's needs, often requiring multiple checks and adjustments throughout the day. Since, the body just can't produce insulin on its own, people with type 1 diabetes must work closely with their healthcare team to monitor their blood sugar and adjust their insulin doses as needed. Education and support are crucial for managing this lifelong condition. Type 2 diabetes, on the other hand, is often managed with oral medications and significant lifestyle changes. These medications help the body use insulin more effectively or stimulate the pancreas to produce more. In addition to medication, adopting a healthy diet, increasing physical activity, and losing excess weight can make a big difference in controlling blood sugar levels. And in some cases, When oral medications and lifestyle changes aren't enough, people with type 2 diabetes may also need to use insulin to keep their blood sugar in a safe range. Other key aspects of diabetes treatment include regular physical activity, which helps the body use insulin more efficiently, and frequent blood sugar monitoring to track progress. Eating a balanced, low-sugar diet is important, as is managing stress, since stress hormones can raise blood sugar levels. Support from family, friends, and diabetes educators can also make a big difference. Early and consistent treatment is vital, as it helps prevent serious complications like heart disease, kidney failure, and nerve damage. By working closely with healthcare professionals and making healthy choices every day, people with diabetes can lead full, active lives. The good news? Type 2 diabetes is often preventable. Here's how. Eat whole, nutrient-dense foods, cut down on sugary drinks and processed snacks, maintain a healthy weight, and exercise regularly. Even walking 30 minutes a day helps. And don't forget to get regular checkups, especially if diabetes runs in your family. Diabetes doesn't have to define your life. With the right knowledge, lifestyle, and medical care, it can be managed and in many cases prevented. Stay informed, take action, and let's fight diabetes together. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell. Drop a comment below if you or someone you love is living with diabetes. And share your journey.